My name is Nik Bakti. I'm one of the orthopaedic consultants here at Ashford, and my special interest is upper limb surgery. I was born and brought up in Malaysia, and I grew up there till I was 16. Why I got into medicine is an interesting question, because none of my family members are involved in the medical profession, and maybe that was one of the reasons why I chose medicine, because none of what they were doing enthused me or got me excited. And I'm never really a risk taker, so maybe that naturally just made me choose medicine. But when I was 4, I was quite unwell, and I had to have an operation with a long recovery period. And 31 years later, I'm still alive, and I think I'm grateful to the surgeon that helped me get through that period. So maybe subconsciously that just made me choose medicine, and I happen to be quite good at it. I've always liked to take things apart, toys, cars, anything. So I'm quite handy with my dexterity. And when I was training to be a doctor, most of your time spent doing medicine, and I found that a little bit not very exciting. But when I did do my surgical placements and you start putting things together in orthopedics and fixing broken bones, it just brought me back to when I was dismantling my remote control cars and putting them back together. So I guess it's the manual dexterity, the hands-on bit that really attracted me, and it brought me back to the things that I was really excited to do when I was a child. There are two types of days that I have in my line of work. One type of day is when I spend most of my time in clinic, and this involves seeing new patients and trying to uncover why they are in pain and uncomfortable, and try to come up with a diagnosis, investigate them. And this is quite interesting because it's almost like solving a mystery. Getting all the clues, getting the right investigations, and then coming up with a plan. So it's quite interesting. The other bit of my day in clinic would be seeing the patients that I've operated on, seeing what progress they've made following the operation. And the second type of day that I have is the day that I spend in theatres. And this is the highlight of my week, because this is where I enjoy playing with the tools, putting things that are not quite right back straight, and getting patients better. So I look forward to the days that I spend in theatres, and I tend to separate my week into two: beginning of the week, clinic heavy, and the end of the week, theatre heavy. So I have that to look forward to in a long week. All the theatres is what I enjoy being in, doing my operation. It has to be when patients come back and say that the operation has been a success and they're now pain-free and they can get back to what they enjoy. That has to be the best part of my job. Nothing beats that. So I've got a very young boy, he's 8, full of energy, and he's my best friend. So we do everything together, and any moment that I'm not working, I'm with him. So he enjoys football, cycling. So even if it's rain, sleet, snow, we're outside doing something. So that's how I spend my time outside work.